I found out I was HIV positive in 1999. I was in prison at the time. That was my second time in prison. And fortunately, I've managed to stay out of prison altogether ever since.
I was diagnosed in 2009 and was not treated for some time after from some misinformation I got in another state.
My diagnosis was so traumatic and difficult that I've dedicated my life to making sure that nobody else goes through the same pain that I did, if I can help it.
I just hope that we're able to continue to treat this as a chronic condition, kind of shed the stigma that's been associated with the disease for so long.
There is still stigma out there today. Sometimes I'll hear people just say stuff regarding HIV. They'll be like, that person has HIV, stay away from them. I'm like, what?
You have to walk through the world with a disclaimer. Whenever you meet somebody or you begin a relationship, you have to make sure that they know this thing up front.
The stigma around HIV is one, how it's transmitted and how it can be transmitted to others. There's definitely some incorrect information around HIV where people think that it's a disease that's wrapped around one particular race or ethnicity.
After I was diagnosed with HIV, the community was there to wrap their arms around me and to welcome me and to support me through the difficult transition that is an HIV diagnosis.
Newly diagnosed, we to come to One Community Health and ask questions if you have quick concerns.
So when I moved to Sacramento, I was looking to get into HIV care, and I found One Community Health. I made a phone call, and I was, brought into care very quickly, very easily, very smoothly, and I knew that I wanted to work here.
I hope that positive people going forward, people who have a diagnosis, I hope that they're able to live comfortably in their skin. I hope that they are able to move through the world in a way that is accepted and understood, that the common person would engage with somebody who is positive. I can't wait to see more people who are positive having babies in families, and I hope to see them at events and see them thriving.
My hopes for people who are living with HIV is that we can just be looked at as humans. HIV is a very difficult diagnosis, and it's looked at in a very particular way by our society, and I just want to shed all of that stigma and judgment and just be a human among humans.
What I hope for is that people won't worry about dying so much. There's an actual possibility of getting better and feeling better.
We stand on the shoulders of giants being here today, people that sacrifice their bodies to be tested for new medications and new treatments and pave the way for the newer generation of people that are living with HIV and give them the option of having these once a day pills or injectables once a month.
We are honored to celebrate World AIDS Day for those who we have lost in the fight, to those who are still with us. Let's move forward together.
Let's move forward together.
Let's move forward together.